Hello everyone, and thank you for joining me. Today, I'll be presenting my literature review titled The Effect of Sourdough Bread on Bowel Movement Frequency and Constipation Symptoms, Blood Glucose, Celiac Disease, and Inflammation. This review explores the potential benefits of sourdough bread compared to conventional bread, particularly focusing on digestive health, metabolic markers, gluten sensitivity, and inflammation. Let's begin with the background and significance. Chronic constipation is a common gastrointestinal issue affecting up to 20% of the population. It can lead to significant discomfort and impact a person's quality of life. Standard treatments such as fiber supplements and laxatives often offer only partial relief and may come with unwanted side effects. In parallel, blood glucose control and chronic inflammation are key components of managing conditions like type 2 diabetes and cardiovascular disease. And in individuals with celiac disease, managing symptoms through diet is critical. This growing need for natural and holistic interventions has sparked interest in fermented foods, especially sourdough bread. Sourdough bread is unique because it's made through a natural fermentation process using wild yeast and lactic acid bacteria. Unlike commercially produced bread, which uses instant yeast and has shorter fermentation time, sourdough may offer additional health benefits. In this presentation, I'll review what current research says about its effects on digestion, metabolic marker, and more. The purpose of this literature review is to evaluate and synthesize current research on the health effects of sourdough bread consumption with focus on its impact on bowel movement frequency, constipation symptoms, blood glucose regulation, inflammation, and celiac disease. By comparing outcomes from studies involving sourdough and commercially produced yeast leavened bread. This review aims to identify whether sourdough offers meaningful benefits for digestive, metabolic, and immune health. The findings may help guide future dietary recommendations and support the role of traditional fermentation in managing chronic gastrointestinal and metabolic conditions. Now let's talk about the research question. In adult age 18 to 80 years old, what are the effects of sourdough bread consumption compared to commercially produced yeast leavened bread on bowel movement frequency, constipation symptoms, blood glucose regulation, inflammation, and celiac disease? The population here is adult age 18 to 80 with either chronic constipation, type 2 diabetes, and celiac disease. The intervention is daily consumption of sourdough bread made with natural yeast, while the comparison is daily consumption of commercially produced bread with instant yeast. The outcome is the effect on the bowel movement frequency and improve the constipation symptoms, lower glucose level, and improve celiac disease symptoms. Before moving to the literature review, let's talk about some term definition. First, chronic constipation, which defined as fewer than 3 bowel movements per week, with symptoms such as straining, hard stool, and incomplete evacuation lasting at least 3 months. Sourdough bread, which is bread made using traditional natural fermentation methods with wild yeast and lactic acid bacteria over 12 to 24 hours. Commercially produced bread, is a bread made with instant yeast produced quickly with modern industrial processes. Bowel movement frequency, it's the number of stool passed per week, used as a measure of gut motility. Constipation symptoms, including bloating, abdominal discomfort, straightening, and hard stool. In this slide, we have more terms. Gut motility, the movement of contents through the digestive tract, measured through symptoms reports. Gut microbiota diversity, the variety of microbes in the gut, assessed via fecal sample analysis. Blood glucose response is measured by the rise in blood sugar after eating, typically using IAUC. Inflammation, low grade, chronic, is a persistent mild immune activation associated with a metabolic disease, measured by markers such as PAI1 and SICAM1. Celiac disease is an autoimmune condition triggered by gluten ingestion, required a lifelong gluten-free diet. Satiety, the feeling of fullness and reduced hunger following meals, influenced by hormones such as ghrelin. To answer the study question, I reviewed several peer-reviewed studies, including randomized controlled trials, systemic reviews, and crossover studies. These studies examined various populations, bread types, fermentation methods, and health outcomes, such as glucose response, gastrointestinal symptoms, and inflammatory markers. The findings were synthesized to highlight trend and differences between sourdough and conventional bread. Let's start with constipation. Fermented food, including sourdough, are believed to support gut motility and elevate constipation symptoms. One randomized controlled trial found that sourdough bread improved gut microbiota composition and support digestive health. Another study in 2024 examined how different bread fermentation method affected GI symptoms in individuals with non-celiac wheat sensitivity. It showed that fermentation time and flour type might influence digestive outcomes, although individual response varied. Furthermore, the short-chain fatty acid produced during fermentation, like butyrate, are known to stimulate gut motility. These compounds nourish colon cells and can reduce inflammation in the digestive tract, potentially easing constipation. Beyond constipation, let's talk about the effect of sourdough on inflammation. Chronic low-grade inflammation plays a role in many modern diseases. Some studies suggest sourdough bread may help reduce inflammatory markers. One dietary intervention showed that consuming sourdough bread made with ancient grains led to improvements in markers like ICAM and PAI1, which are associated with vascular inflammation. However, other studies have found no significant changes in inflammatory markers when comparing sourdough to yeast fermented bread. This suggests that more research is needed and that the effect may depend on the type of flour, duration of fermentation, and specific starter culture used. Also, another study found unexpected outcome, with participants reported more tiredness and joint discomfort after sourdough consumption, although this result may reflect individual sensitivities rather than general trend. Now let's look at sourdough's effect on blood sugar. Multiple studies have shown that sourdough bread leads to smaller post-meal rise in blood glucose compared to industrially produced bread. For instance, a meta-analysis reviewed several clinical trials and concluded that sourdough bread leads to lower glycemic response at both 60 and 120 minutes post-consumption. This is important because large spike in glucose can be harmful over time, especially in people with insulin resistance or diabetes. One possible explanation is that the long fermentation process breaks down some of the carbohydrates, reducing the glycemic index of the bread. Also, the acid formed during fermentation may slow down gastric emptying, which is in turn slow glucose absorption. In addition to glucose regulation, sourdough may help with appetite control. One study found that subjects who consumed sourdough breads made with einkorn or organic flour reported a greater satiety and had lower ghrelin levels, a hormone associated with hunger. This could make sourdough a helpful option for weight management or for people trying to control their calorie intake. The fiber and fermentation byproducts may contribute to this increased feeling of fullness. Let's now discuss gluten sensitivity and celiac disease. People with celiac disease must avoid gluten completely, as even small amounts can trigger an autoimmune reaction that damages the small intestine. Some studies have explored whether sourdough fermentation can reduce gluten content enough to be tolerated by those with celiac disease. A clinical trial showed that fully hydrolyzed sourdough baked goods containing only trace amounts of gluten were safely consumed by celiac patients with no increase in anti-TTG antibody or intestinal damage. That said, other types of sourdough bread are not safe for people with celiac disease. So, any gluten-free benefits depends on the specific fermentation process. This remains an area of active research. In conclusion, sourdough bread shows promise as a functional food that could support digestive health, blood glucose management, and potentially reduce inflammation. While it's not cure-all, it may be a beneficial alternative to commercially processed breads, especially for individuals managing chronic conditions like constipation, insulin resistance, or inflammation. However, more high-quality research is needed to standardize fermentation techniques and to better understand which type of sourdough offer the most benefits. Now to summarize the finding. First, sourdough bread may improve bowel movement frequency and reduce constipation symptoms through its effects on gut microbiota and motility. Second, it appears to produce lower glycemic response and may improve insulin economy. Third, some evidence supports reduced inflammation and increased satiety, though findings are mixed. Finally, certain sourdough formulation may be safe for gluten-sensitive individuals, but not all sourdough is gluten-free. Now let's talk about the limitation. Despite promising results, research findings are not always consistent. For example, one randomized control trial found no difference in postprandial glucose or insulin responses between sourdough and modern wheat bread. Another study found an unexpected outcome, with participants reported more issues. The major limitation across the studies is the lack of standardization in how sourdough is made, Different studies use different flour types, fermentation times, and microbial cultures, making it hard to draw firm conclusions. Now, the next two slides contain my references for this literature review. Thank you so much for listening to my presentation. I hope it has provided valuable insight into the current research surrounding sourdough bread and its potential health benefits.